Dr. David Beetlebaugh, Canale Chiropractic Relief Center. I want to talk about you. You're the most powerful provider for your health than any doctor on this planet. Certainly doctors, healthcare providers can give us good help with either a medication, a treatment program, advice, so many things. But it's what we do with it that counts, and are we doing the right things? So here's what I would recommend to you as a formula. Number one, recognize there is an issue that you need to deal with. And some issues you don't see so much. One issue can be you can't bend the knee all the way. Well, that's an issue because you may fall and hurt it. So how do I get it back from here to there so I can avoid the injury before it happens? If it's a problem for you, how do I improve it? Your range of motion, your health, or I'm fatigued because so many things just aren't functioning right. Number one is admit there is an issue. And number two is find the best source for how to manage it or take care of it or get rid of it. And that best source isn't always who you think it is. Do they really specialize in it? I don't mean a specialty with a lengthy credential. I mean someone that's actually doing it all the time. So example, one of the worst things you're going to hear is, oh, that's normal for your age. I hate that because most of the time that's not the reason why it's happening. It's that many people that age get it, which doesn't make it normal. It makes it common, which is very different. Normal is if my skin is aging evenly throughout, not one area over here aging. The same with the spine. If two of them are really bad and the rest are beautiful, the bad ones are not normal for the age. So if my range of motion is here and many people my age only go there, that doesn't make it normal for my age because I have two knees and the other one does this. So normal for the age is not what is usually correct, and when you hear that, I would say be careful of that person telling you that. So what you want to do is admit there's an issue, get the best information you can, and the most important thing is to act upon it. It's what you do at home on a regular basis more than anything else, because waiting for the trainer to come, which is also good, but that's an extra. Going to the gym, which is great, but that's an extra. But what if you're on vacation? What if you can't get there? What if it's closed? What if that person moves someplace else? It's all about you. So you do a little bit every day. Maybe it's 15 minutes a day. Maybe it's every other day 20 minutes. Maybe it's 10 minutes. But something on a repeated basis so it creates a repetitive good that builds your motion back, which helps to reduce pain, get circulation deeper, keep you healthy, or whatever it is. You are your strongest provider, but you must act upon it. Dr. David Beetlebaugh, Canale Chiropractic Relief Center. I hope you find this helpful. Thank you.